everyone. Today we have Ken, our patient. We'll be doing FUE hair restoration, reinforcing zones 1 and 2. The hairline, going back 7 centimeters, going into zone 2 as well. The goal is to target around 3,500 grafts. You're excited, Kim?
I'm very excited.
You're excited? Any last minute thoughts you want to share, concerns of what you're looking forward in having done?
Actually, I'm so nervous to say anything right now.
Oh, you're nervous. Okay, in a few minutes the medication we gave you should
Okay.
kick in and you should be very happy. Sounds good. Alright. We're shaving your donor region right now, Ken.
Okay.
Alright. You have lots of multiples. Donor region looks fantastic.
Hopefully.
Looks really good. The goal is to target 3,500 grafts from your donor region. And then in a year out, it's going to look fantastic. Have a marker. Alright, Ken, you're going to feel a marker in your donor region. This is the area that we're going to harvest your grafts, like I mentioned. We're just making a grid to break down your donor region into equal boxes and target roughly around between 100 to 150 from each square. Bring your chin down a bit. Very nice. In a few seconds, Ken, you're going to feel a quick needle poke. We're going to do a nerve block. This is the worst part of the entire procedure. Okay? It's going to be very short and it's going to be very quick. But it's going to sting for a few seconds. Afterwards, you shouldn't feel anything. We just finished the nerve block with Ken. How was that, Ken?
It's pretty good.
Yeah.
That's something to allow.
It's few seconds, but it stings.
Yes.
What's the pain scale out of 10 being the most painful?
Just like a pokey.
Like a poking feeling?
Yes.
Okay. So we did a nerve block on the right and the left and the back of the head.
Mm-hmm.
And now what we're going to ask is if you could actually lie down on your stomach, and we're going to start the harvesting phase.
Okay.
Okay? Any pain, Cam?
No,
Not feeling anything?
no, nothing.
Perfect. Your grafts are beautiful, lots of multiples.
Oh, that's good.
You're barely bleeding, which is great.
Mm-hmm.
Your grafts are coming up beautiful. It's a nice triple right there.
Really?
And that's a 4. 4 hairs in a single graft. This is a nice triple as well. One graft with 3 hairs, triple the density. And there's another triple.
Another triple.
They're all gorgeous grafts you have, Kim.
Mm.
Great quality. Congratulations, Ken. We're done with the harvesting phase.
Thank you.
So as they were still counting in the back your grafts and the percentages, I went ahead started working on the design. Okay. Do we have the final numbers?
Yes, we do. So for singles, we have 27%, 998 grafts. Doubles, we're at 1,527 for 41%, and triples, we have 1,205 with 32%.
And what is the total?
Total number is 3730.
Oh, okay. So we have extra 230 grafts.
Wow.
We were aiming for 35, up to 35, but we ended up with extra 230. So you're going to have a little bit more coverage going to the back.
Perfect.
Okay, so 3,730, 30 or 20?
28.
3730?
3730.
3730. And your percentages are over 70%, 73% doubles and triples, which will give you the awesome density.
Oh, perfect.
Okay, so let's take some final measurements and work on the hairline.
Alright.
And then we'll show you what it looks like. 14 from chin to eyebrows. 7, perfect. So this way your face is actually equal 1/3, okay? And we're going to 7 centimeters all the way to this midsection of the scalp. And now what we want to do is we want to place some softeners in the very front. Can I please have a fresh marker? Thank you. You want the hairline to be as irregular as possible, Ken. So it doesn't scream too
True.
perfect. All right, you want to take a look?
Yes, one more time, please.
Tell me what you think.
It's not good, it's just great. Yep.
Is this what you're looking for?
Yeah,
I think it looks fine.
it is.
It looks great.
With my forehead and the line is matching like how I like it.
Yes. The hairline isn't too flat. It's
Mhm.
not aggressive. It kind of has a slight recession
Yes.
into it. We didn't give you the hairline once you had when you were 18, but it's still aggressive but not quite.
Yes. Where was when I was 18, like somewhere right
Raise your eyebrows. Exactly. The
Right
areas that
close.
don't wrinkle was all covered in hair.
here? Right here, right? Like,
Yes. exactly.
Yeah, that's good like that.
But once everything is filled in, this
Mhm.
is what your profile. Turn to the left a bit. Everything should look like that once everything's filled in.
Especially someone kind of come from the
Yeah, it's not a very flat hairline,
Mhm.
but I think it looks really good.
Yep. I like it.
Or I should say, it looks really great. You
It's
like it,
amazing.
Ken?
I love it.
Alright,
yes.
so what we're gonna do is we're gonna break for lunch.
Okay.
After lunch, we'll come back. We'll continue with the incisions, okay?
Okay.
And then we'll shave the rest of the hair
Mhm.
after.
Okay.
Okay.
I'm glad this hair area will be good because I have like very thin hair here.
Yes, and this area you want to hold on to it as long as you can
Mhm.
with the options we talked about with the finasteride, with the minoxidil,
Yeah.
possibly the PRP
Will.
as well. Okay, so that
Mhm.
way this sticks around much longer.
Okay.
All right, but your front is gonna look fantastic.
2009 when I was in army. That's it in my life.
The last time you had your head shaved was when?
2009.
2009.
No,
All
really.
right, so we got the design. I think it looks really good.
Mhm.
So what we're gonna do next is we're going to shave the rest of the hair.
Okay.
You want me to shave the whole thing?
You can shave whole thing.
All
That's
right. So this next part, Ken, is gonna be a little bit uncomfortable, meaning not really uncomfortable, but it's gonna feel a few seconds of needle pokes.
Mhm.
We're gonna do a nerve block, okay?
Okay.
That's going to numb majority of your scalp on top.
Perfect.
And you're also gonna feel something that's a little wet, that's gonna be disinfectant, okay?
Oh, okay.
We're gonna clean the scalp. Alright, Ken, we're all done with incisions. Take a look. Hopefully it wasn't that painful. What do you think?
I can't tell. It's very good from now on.
The grafts haven't been implanted just yet.
Yeah, this
So we
area
worked
probably-
on zone 1.
This
This
is crazy.
your size was a little bit larger. Typically the temple goes from the center to forehead 8, yours was 9.
Yeah.
So we used roughly around 2600 just in zone 1. Typically we use about 2200. And then we used about another 1000 to 1100 towards the back.
It's
Okay,
amazing.
zone 2. Very nice density.
It looks very good.
Your head, keep in mind, it's swollen, okay?
Yes, it is swollen.
It's swollen, it's all fluid inside,
I can
but
tell.
it
Yeah.
looks amazing.
Looks
This
very
is gonna come down the next few days,
Mhm.
okay? We calculated your doubles, your triples, and your singles all together. You have over 10,000 hairs today with the percentages that you have. It's basically
Perfect.
going to cover the first half of your
Mhm.
scalp, and your zone 3 and 4, you already have coverage.
Yes.
Now the plan is to make those stronger and for you to keep it as long as you can.
Correct.
Do you like it or do you love it?
I love it.
You love it? Sounds
You know
good.
that, sir.
Sounds good, Ken. So we have
Very
a few
nice.
more hours.
Mhm.
Basically, the next phase you'll be sitting upright, watching a movie on demand.
Mhm.
Cartoon, not cartoons. Action movies, drama, comedy, whatever you want to watch.
Okay.
A few more hours and we'll call it a day afterwards.
Okay.
Okay?
Alright.
We'll see you tomorrow for a follow-up as well.
Alright.
All right. Congratulations, Ken.
Oh, thank you guys. I appreciate all of you guys.
Apologies, you're getting a little wet. It
It's okay.
looks absolutely fantastic. How long did you say you've been wanting to do this?
2009.
2009, so how many years is that? 7 years?
7 years and I finally find the right places.
Thank you so much, appreciate your kind thoughts. It really looks really good. Bring your chin up for me, we're just gonna do a nice wash. Wanna take a look?
Yes, please.
Drum roll.
Oops.
What do you think?
It looks good. I like it.
You like it?
Mm-hmm.
These surgical markers will go away in the next few days. The hairline will come down even lower, right on the left side. Okay.
Good.
You like it?
Yeah. Thank you
Alright,
guys.
awesome. Pleasure, Ken, having you today.
Thank you. I appreciate you, all of you guys.